Good morning, everyone. We're going to go ahead and get started right on time at 11 a.m. Just a couple of quick housekeeping items before we begin. First of all, this webinar is being recorded and it will be posted on our website by the end of this week. All participant lines are muted, but you are welcome to submit questions in the Q&A portion. There's actually a chat feature down at the bottom of your screen, so you can submit questions through that, and we will try to address them during the Q&A portion of the webinar at the end, right around 11:40. My name is Melissa DeBilzen. I'm the Interim Executive Director of Safe Passage for Children of Minnesota. And Safe Passage was founded in 2009 to advocate for reforms in Minnesota's child welfare system, guided by a simple principle that all children should be protected from abuse and neglect. There's a saying that it takes a village to raise a child, and just as importantly, it takes a community to pay attention, to know when something isn't right, and to ask difficult questions when children are harmed. Safe Passage for Children of Minnesota is a nonprofit organization focused on examining the systems responsible for protecting children. We do not provide direct services. Instead, our work centers on research, data, and policy analysis related to child protection and child well-being. We recognize that the child welfare system includes many interconnected parts, from child protection agencies, courts, county attorneys, mandated reporters, mental health practitioners, guardians ad litem, and the outcomes for these children depend largely on how well those systems are all working together. So it truly does take a village to raise and to protect a child. Today's webinar focuses on our latest report examining child fatalities resulting from maltreatment in Minnesota. We'll walk through the findings of that report and briefly discuss some of our recommendations aimed at strengthening child safety. Before we do, I'd like to introduce our board president, Dr. Lisa Hollensteiner, who will provide a bit more context about Safe Passage and the report. Lisa?
Good morning. As Melissa noted, Safe Passage's work is grounded in legislative reform and research, guided by the core belief that child safety must always be the priority. From a legislative standpoint, we advocate for common sense policies that strengthen child safety and well-being. A couple examples from recent years are strengthening mandated reporter training and a bill making it a felony to knowingly expose children to fentanyl. Our priorities for this year include codifying the use of volunteer guardian ad litems, requiring licensed childcare facilities to post signs about recognizing signs of child abuse, and fiscal analysis. Where is the money coming from and where is it going to in the child welfare system? We will be working on these issues throughout the legislative session and hope that you can join us on April 14th at Day of the Hill to advocate alongside us. More information is on our website. You can also sign up there for our weekly brief that gives more information about how you can become involved. In addition to our legislative work, Safe Passage conducts child maltreatment fatality reviews to identify trends and systemic gaps where reform is needed to prevent child harm. This is our third report, now 10 years covering 200 fatalities. While this research cannot help the children who have already died, our hope is that the data will illuminate patterns and failures that must be addressed to better protect Minnesota's children. Child maltreatment is increasing, and these numbers are not just statistics. They represent real children and real families. Every death is a tragedy and a heartbreak. The number of children dying from maltreatment is comparable to the number of children dying from cancer. We owe it to them and every child in Minnesota to build a system that does a better job of protecting them. Of note, Safe Passage has been a national leader in this area of research, and our fatalities review received national attention in this child welfare field. Presenting the findings today is Courtney Anakin, who is Safe Passage's 2025 Archbishop Ireland Justice Fellow. She graduated from University of St. Thomas Law School in 2024, was admitted to the bar later that year. She is the primary researcher, analyst, and author of this report. And I want to acknowledge not only her rigorous research, but also the emotional toll of reviewing extensive documentation on child maltreatment and deaths. Courtney was supported by two supervisors who dedicated countless hours to this work: Rich Gehrman, who's founder and director emeritus of Safe Passage, and Dina McMahon, a family therapist and consultant. Finally, we want to thank all of you who work within the child welfare system. Your efforts to keep children safe matter deeply, and we are grateful for the work that you do every day. We welcome the opportunity to meet with anyone who wants to learn more about us or join our efforts to protect children. And now, Courtney.
All right. Good morning, everyone. Thank you again for being here today. I'm presenting Safe Passages 2023 to 2024 Child Fatalities from Maltreatment Report. I'm going to start by covering the basics, what the report is, how we conducted our research, and the limitations we encountered. I'll then walk through some of our major findings, explain the statistics behind them, and illustrate those findings with a few case examples. I'll then cover policy considerations, how we believe these things could change for the better, and then end with some closing remarks and our recommendations for change. I want to start by remembering that our data is not just numbers, but represents the tragedy and heartbreak of young lives lost. Here are a few of the children in the report. All right. This is the third Safe Passage report on child maltreatment fatalities. It covers children who died due to maltreatment between June 1st, 2023 and December 31st, 2024. Although fatalities represent a small portion of the child welfare system, they represent lost opportunities for children to grow and thrive. Safe Passage has now collected more than 10 years of data, documenting over 200 maltreatment-related deaths. In this reporting period, we identified 44 child fatalities, 36 of whom we were able to identify by name. After the research period, 4 more children were identified by lives cut short. The responsibility of keeping children safe falls onto the entire child welfare system. The system includes CPS, but also includes law enforcement, the courts, mental health providers, medical providers, and legislators. The goal of this report is not to assign blame to any one person or group, but to identify areas for positive change. To gather this information, we use two main types of sources: sources that helped us find the child and sources that helped us understand what happened. To identify children, we monitored major newspapers, received Google alerts, and we consulted nonprofit databases, specifically Violence Free Minnesota and Lives Cut Short. Lives Cut Short, who compiles child maltreatment fatalities for the entire country, was kind enough to share the Minnesota death records they received at a data request, which was also a source. We also used information from DCYF's Critical Incident Details reports, which, although high level, helped us estimate the scope of fatalities. To understand each child's circumstances, we obtained county fatality disclosures and reviewed juvenile, criminal, and family court records. These sources allowed us to reconstruct the conditions leading to each death and identify broader systemic issues. We had a few issues with transparency during this process. The two main state reporting tools, the DCYF Critical Incident Detail Report and the county fatality disclosures, are unreliable and inconsistent. CIDRs are extremely high level and sometimes contain errors, while counties vary widely in what they release, how much detail they provide, and how quickly they respond. Some counties provide extensive documentation, others send only a page, and some never respond at all. As child maltreatment deaths rise, this lack of standardization and transparency prevents stakeholders from understanding what happened and from making the systemic changes needed to prevent future tragedies. We must clarify and enforce statutory requirements that require the state and counties to make data publicly available regarding near fatalities and fatalities. With that background, we'll now turn to the major findings for this report period. Our first and most significant finding is the continued rise in child maltreatment deaths. Across 19 months, we documented 44 deaths, averaging around 28 children killed per year, which is a substantial increase from roughly 20 children per year in previous reports. 1 in 5 of the child deaths from this report died from fentanyl ingestion. As you can see, 3 manners of death, fentanyl poisoning, asphyxiation, and fatal gunshot wounds, share the majority of maltreatment fatalities for this reporting period. Many of these deaths were due to neglect. Drug toxicity deaths are on the decline, but still a major cause for concern. There was a 22% decrease from our 2022 to 2023 report, but still a noted increase from our first report covering 2014 to 2022. This is most likely due to the rise in pervasiveness of fentanyl. The most common fact pattern is a young child finding either fentanyl or fentanyl-laced paraphernalia, putting it in their mouth, and overdosing. Although it is important to have empathy for parents in active addiction, the reality is that parental drug use can be deadly for children. This points to the need for practices that do not put children in danger while parents are managing their addiction. Another major manner of death was asphyxiation. In multiple cases, parents would use their preferred substance and put their child in an unsafe sleeping environment, causing that child to asphyxiate. There were two deaths where the child was purposely suffocated and one where the child had an hours-long fatal asthma attack due to her parents not refilling her inhaler nor taking her to the hospital. In our previous report, we wrote that a possible pattern of deadly neglect via unsecured firearms might be developing. Unfortunately, we were correct. Out of 9 known gunshot wound fatalities, 4 of them were due to deadly negligence, or 9% of overall maltreatment deaths. These deaths would have been prevented by adults storing firearms unloaded and separate from ammunition. We must strengthen accountability for unsecured firearms, including temporary removal of children if there's no immediate remediation of danger. Over the decade of data we've collected, we've seen a consistent rise in neglect-based deaths. 28 fatalities, or 63.63%, died due to the neglectful actions of their caretakers. This aligns with our 2022 to 2023 report, where neglect caused 61.9% of deaths. However, both of these percentages are a large increase from our first report, where only 26.13% of deaths were caused by neglect. The data suggests that the rise and pervasiveness of fentanyl, again, is at least in part responsible behind that for this, along with our first report wholly relying on media reports, which can overrepresent physical abuse deaths. Nationally, the Children's Bureau of the United States Department of Health and Human Services reports that around 70% of child maltreatment deaths are due to neglect, with their 2023 child maltreatment report stating that 78% of deaths were in part due to neglect. Minnesota remains under the national percentage, but neglect-based deaths still account for a majority of our cases. As in previous reports, children 3 and under are the most vulnerable due to their total dependence on caregivers and inability to defend themselves or seek help. During this reporting period, children 3 and under were the vast majority of deaths, representing 75% of deaths overall. Within that group, almost half of the overall fatalities were children 1 to 3 years old, and 1/3 were less than a year old. This is a minor increase from our previous report, in which 66.6% of fatalities were children 3 and under, but it is in line with our first report that had 78.4% of fatalities being children 3 and under. There was a wide range of ages, with our oldest child being 16 years old and our youngest child being 19 days old. Child Protective Services came into contact with either the child or the family 22 out of 44 times, or 50%, before the child in question was killed. This includes both screened in and screened out reports, and many children had open CPS cases at the time of death. This represents a 17% increase from our 2022 to 2023 report. However, it is a decrease from our first report, where 67% of families had previous contact before the fatality. Although this contact might not be recent at the time of the child's death, counties often still have opportunities to intervene before a fatality occurs. They also emphasize the need for child-centric and preventative policies made by stakeholders. For this report, caregiver substance abuse co-occurred with child maltreatment in 40.9% of cases. Like I mentioned earlier, the presence of substance abuse among caretakers continues to directly account to a large proportion of child maltreatment deaths. In addition, substance abuse is a significant contributing factor in additional fatalities, namely asphyxiation deaths. The co-occurrence rate of domestic violence, also known as intimate partner violence, was 52.27%. Domestic violence continues to be closely intertwined with child maltreatment deaths. Even if they are not eyewitnesses, children experience deep emotional trauma when one of their caregivers is a victim of abuse. Unfortunately, the current practice screens out domestic violence calls when the child is not in the room nor expected to intervene. An important aspect of domestic violence is the lack of accountability for the abuser. In this period alone, 4 out of 9 primary perpetrators had violated a domestic abuse no contact order, also known as a DANCO, or 44.44% of the time. Considering research shows that domestic violence is underreported, it's likely the violations are more prevalent than the data reveals. We believe these statistics are best illustrated by case studies. We're going to start with our first case study, Jackson Wydell. Jackson Wydell was an 18-month-old child who died from fentanyl toxicity on Christmas Day 2024 after ingesting his father's fentanyl. Investigators later found the home in a filthy condition, with drugs and drug paraphernalia accessible to the children. The family had a long history with Child Protective Services related to the parents' chronic drug addiction. Jackson's mother had 2 previous terminations of parental rights in 2018 and a maltreatment determination in 2020 for parental drug exposure. During the 2020 case, both parents received addiction-related services. On December 1st, 2024, 24 days before Jackson's death, another child protection investigation was opened due to prenatal exposure involving Jackson's younger sibling. The county implemented a safety plan under which Jackson's father was designated as the gatekeeper for the mother's drug use. She was prohibited from unsupervised contact with the children and from being in the home while using drugs. After a multi-week stay in the hospital, the infant sibling was released to the father's care 6 days before Jackson's death. A home visit was conducted the next day, which resulted in the home being deemed safe. Jackson died 5 days later. After Jackson's death, his mother admitted that she had lied about the father's sobriety. Both parents were actively using fentanyl and did so on Christmas morning. Jackson's death was preventable. Despite the family's extensive child protective history and both parents' known substance abuse, the county relied on unverified claims of the father's sobriety and left the children in the parents' care. Our next case study is Thomas Pauza Moore. Thomas Pauza Moore was a 4-year-old child who died on August 8th, 2023 from a self-inflicted gunshot wound caused by an unsecured firearm in his father's home. First responders found Thomas deceased at the scene. A semi-automatic pistol was found on top of an unlocked gun safe in the father's bedroom, and additional firearms, namely an unloaded rifle and a loaded shotgun, were accessible in a nearby closet. The autopsy confirmed a gunshot wound to the head as the cause of death. Thomas's father told police he was downstairs playing video games while Thomas was alone upstairs. He acknowledged that Thomas had previously knocked over the gun safe. The home showed signs of neglect, including dirty floors and counters, holes in the wall, and alcohol containers left out. 2 days after Thomas's death, his mother reported that the father routinely left out firearms unsecured and that she had warned him about the danger. She did not seek sole custody during their divorce, citing financial dependence and a desire for their younger child to maintain a relationship with the father. The parents currently share custody of Thomas's sibling. The father was charged with second-degree manslaughter and other offenses, but ultimately pleaded guilty to child endangerment. He was sentenced to 150 days in jail, served 90 of those days, and later requested that the remaining 60 be forgiven. Court records indicate the request was granted. Prior to Thomas's death, there had been at least 2 reports of neglect and a documented history of domestic violence by the father. Between 2020 and 2021, county services received multiple reports, including concerns about overfeeding, an incident in which Thomas's father assaulted Thomas's mother in front of Thomas, and a case where the father was found asleep when responsible for childcare. Despite these warning signs, no mandatory services or sustained interventions were implemented. In reviewing the case, subject matter experts emphasized that the father demonstrated a pattern of unsafe caregiving and that the mother, as a victim of domestic violence, needed stronger support. Given that domestic violence history and ongoing risks, voluntary programs were insignificant or were insufficient. A mandatory court-ordered case plan may have offered a more effective path to ensuring safety. And our final case study is Zaire Bagley. And apologies, I did not have a photo for him. All right. Zaire Bagley died on July 16th, 2023, at 4 months old after his mother fell asleep holding him while under the influence of methamphetamine. His father was also in the bed, and police reported the home was in disarray. Both parents had long histories with protective services. Zaire's mother had at least 30 CPS contacts dating back to 2012 for substance abuse and neglect, including incidents involving drug activity and lack of supervision. Services were offered but many times, but her participation was inconsistent, and her children were removed once in the past. Zaire's father also had an extensive involvement with social services starting in 2014, related to substance abuse, domestic violence, and child maltreatment. This included physical abuse and unsafe behavior involving his children. Despite being assessed as high risk, 2 of his cases were closed. Altogether, the 2 parents had 84 contacts with social service agencies. In February 2023, just before Zaire's birth, the county had a safety meeting during which the mother admitted to recent methamphetamine use. Zaire was born on March 1st, 2023, with multiple drugs in his system and spent 2 weeks in the NICU for withdrawal. He was later released to his mother under a safety plan. In the days before Zaire's death, multiple reports described the mother behaving erratically and appearing intoxicated. Police responded several times, but did not complete a welfare check. After Zaire's death, the county acknowledged both parents were still actively using substances. The mother was not charged with the crime, and after a child protection case, her surviving children were eventually returned to her care. With these findings in mind, we now turn to the broader drivers shaping current policies and practices and how they harm children. We'll do this by addressing common misconceptions in the child welfare system. Oh, there we go. One major misconception is that neglect is less serious than abuse. Minnesota data shows that 63% of maltreatment fatalities involve neglect. Nationally, the rate is even higher. Research demonstrates that chronic neglect can cause severe, lasting developmental change or damage. Neglect can also be more serious and is often very deadly. We must recognize the seriousness of neglect when considering child removal, as there are increasingly number of children dying in homes with significant parental history of substance use disorders. Another misconception is that CPS removes children because of poverty. State guidance is explicit. When conditions are due solely to poverty, maltreatment findings should not be made. Furthermore, research indicates that only about 1 in 4 neglect referrals involve material needs, and those cases are far less likely to be substantiated. Additionally, many families in the child protective system are there not because of poverty, but due to substance use, untreated mental health issues, or domestic violence. Another frequent claim is that removing children is more traumatic than leaving them in unsafe homes. While removal can be traumatic, so is remaining with abusive or chronically neglectful caregivers. The Harvard Center for the Developing Child outlines severe, lasting consequences of neglect. The core issue is balancing risks in each unique case, something made harder by the limited research comparing the trauma of removal versus the trauma of ongoing harm. We also hear the claim that foster care is a worse alternative. However, recent studies show that for infants and young children, foster care is often protective. One California study found that infants reported for maltreatment were 1.7 to 3.2 times more likely to die of medical causes. But when placed in foster care, their risk of death dropped by about 50%. Many adults who experienced foster care also report it as a positive influence in their lives. Finally, some argue that reporting prenatal substance exposure criminalizes women. But research shows that most women who use substances during pregnancy enter the child protective system within their infant's first year. Avoiding engagement at birth does not protect these families. It misses a critical window for supportive intervention. Research shows that infants prenatally exposed to substances have their fatality risk reduced by half, when they experience even one episode of out-of-home care. We believe several changes in philosophy and practice, combined with state-level investments, are most likely to result in better outcomes. First, we must reconsider the seriousness of neglect. Current practice often removes children only when they face immediate harm or danger, which leaves many in situations of chronic neglect. As shown in our statistical analysis, a significant proportion of child fatalities results from neglect. And for those who survive neglect, the trauma of long-term harm has lasting development and emotional consequences. Neglect must be treated with the same seriousness as abuse. Second, we must hold parents accountable for their actions. Too often, parental behaviors that repeatedly endanger children go unanswered. Voluntary terminations of parental rights don't trigger automatic investigations. Children are returned to parents who fail to address chronic substance use, leading to ongoing severe neglect, which can be fatal. Parents who negligently cause their child's death are less likely to be charged and typically receive shorter sentences. These practices favor protecting parental rights at the expense of child safety. In turn, it's necessary to place infants born with evidence of withdrawal from intoxicating substances on an emergency hold until a meaningful, measurable, and enforceable safety plan is in place. Additionally, the system should consider the totality of circumstances, including history of treatment and chronic drug abuse, or history of maltreatment and chronic drug abuse, in decisions related to screening, removing, placing, or returning children. Finally, we must hold parents accountable for addressing their behaviors that are harming children instead of reunifying the family based solely on case plan compliance and participation in services. Third, we must improve our response to domestic violence. State policy currently screens out reports until there is a direct risk to the child, despite the research that witnessing violence between caregivers is emotionally damaging for the child. Our case reviews and other research also show frequent failures by law enforcement and courts to properly follow up with victims of domestic violence. Other jurisdictions demonstrate that better protection is possible. For example, in Queens County, New York, domestic violence victims received restraining orders and related documents directly by text to sign, and police conducted rapid follow-ups that improved safety and accountability. Minnesota must develop a systemic policy regarding domestic violence that gives priority to child safety, reduces trauma exposure, and addresses the high rate of noncompliance with domestic violence-related actions such as OFPs, Order for Protections, and DANCOs. Fourth, we must end the overuse of family assessments. Although originally intended for only the lowest risk cases, family assessments now represent more than 65% of all child protection responses. Many fatality cases involve families who had multiple assessments closed within weeks due to non-cooperation. These cases require compulsory investigations and stronger oversight, especially when infants or chronic safety issues are involved. We recommend allowing cases to be assigned to family assessment only once, but never if the alleged child victim is 3 and under. Fifth, Minnesota must expand available services, which will be difficult with limited federal funding. Ironically, federal audits consistently criticize the state for lacking the service array necessary to support case plans. This gap undermines worker effectiveness and child safety. One way to expand services is to expand child advocacy centers, which offer services to victims using a one-stop shop model. And their multidisciplinary teams, also called MDTs, who are a group of frontline professionals that work on cases together and make decisions with the child's best interests in mind. This allows them to mitigate additional trauma for children. MDTs may include child welfare professionals, law enforcement, medical professionals, mental health professionals, tribes, community-based agencies, parent groups, and other organizations and agencies serving children and families. The system must follow the national recommendations set forth by the National Children's Alliance to develop and support MDTs in response to allegations of abuse and neglect. Finally, the state must mandate consistent standards. Minnesota is a state-managed, county-administered model for their child welfare system. Minnesota provides minimal statewide structure, leaving local practices to vary widely based on resources and interpretation of law. This leads to inconsistent timelines, uneven application of statutes, and placements that prioritize adult preferences over child well-being. State agencies, courts, and the legislature must establish clear, child-focused standards across the entire child welfare and foster care system. The Safe Passage 2023 to 2024 Child Fatalities from Maltreatment Report reviews 44 children killed in just 19 months, showing that child maltreatment deaths in Minnesota are rising, now at about 28 deaths per year. Half of these children's families had prior CPS involvement, and most deaths were due to neglect. 1 in 5 of these fatalities was a result of fentanyl toxicity. These are not isolated cases. We documented dozens of children who were overdosed, who overdosed, were stabbed, assaulted, suffocated, shot, and neglected to death. Often after caregivers were given repeated chances for positive change and despite clear patterns of danger. A growing emphasis on parental rights has led to the tolerance of extreme maltreatment by the entire child welfare system, while transparency from state and county agencies remains limited even after a child dies. Our findings highlight urgent needs for stronger standards for addressing parental drug addiction, real accountability for abuse, neglect, and unsecured firearms, better training for stakeholders, and a greater transparency around fatalities. These deaths reflect concerning systemic issues. However, positive change is possible if we work together. Our shared goal is for every Minnesota child to grow up safe, healthy, and protected. Thank you so much for watching and joining us today. We appreciate your time and your interest in our report in this subject matter. If you're interested in getting more involved with Safe Passage, please visit our website and sign up for our weekly email briefs. I'm also available through the end of this week. There's my email, and then there's also Safe Passage's general email. I'll now open the floor for questions. We've got a lot of time. I talked fast, everyone. Sorry.
Thanks, Courtney. Great job. We did have one question come in through the Q&A, which I'll read in a second. I just want to remind everyone, if you do have a question, feel free to enter it into the Q&A, and we'll try to answer it live. The first question is...
Melissa, let's let Rich and Maggie in.
Yeah.
Please. Thanks.
Yep. The first question is, do you break down medical neglect to identify specifics? Is this neglect around providing medical care, neglect due to exposure to cold, neglect due to poverty versus intent to neglect? Can you elaborate on that a little bit more, Courtney?
We did not break medical neglect down. We most commonly saw parents not get their child medical care, and that was the fact pattern we kept seeing, and less so about exposure to cold or neglect related to poverty versus intent to neglect. It was mostly parents who did not get their child, so objectively did not get their child medical care when they needed it.
So I think she was saying, Courtney, different types of neglect. So we had like neglect due to drug ingestion, neglect due to asphyxiation. So I'm not sure that you broke that down specifically. I will note about the question of poverty neglect. I think that's very important because poverty is not neglect by Minnesota state statute. It's not providing food, housing, etc. And if you're not providing food, housing, if you're reasonably able to do so. So it's only wanton, like keeping food from children. Or we had a child die in our last fatality report who was locked in a cold garage and died out there. I mean, that would be neglect, but poverty would not classify in this fatality review as a cause of maltreatment.
Yeah, I might add that there hasn't been research that's specific to Minnesota. This is Rich Gehrman about this, but there has been national research which has shown that only a small percentage of cases are screened into the lack of material the things that kids need to survive on a day-to-day basis, and only about a quarter of those are actually substantiated. So the universe of cases where someone could mistake poverty for neglect is very small to begin with. It's a quarter of a quarter, and there's no reason to think that workers are making that mistake because the policy is pretty clear. So that's one of the things that comes up a lot is the department or counties screening in people just because of poverty. And I think there's both policy reasons and research to think that that's not actually going on.
All right. The
And
next, oh, go ahead. Were you going to
And I
say
was just saying,
something?
and we support mandated reporter training, differentiating poverty and neglect, because we don't want to have the child protection system overburdened by calls of a child not having a warm coat. That would not be a report to child protection. That needs social service support. We really want the child protection system to focus on those children where there's concern for abuse. So very important differentiation.
Yeah. Next question. How many of those children had open CHIPS cases and a guardian ad litem assigned? I'm not sure if this is referring to the children who died as a result of neglect or just overall in the report, but do you want to comment on that, Courtney?
hmm So that was not one of our statistics we used. It would be for our next report. But however, we do have a fatality index at the end of our report that has information on every child. For guardian ad litem assigned, I believe every case had a guardian ad litem assigned to it.
And that is one thing that we are supportive of this next year is making sure that the volunteer guardian ad litem program in Minnesota remains in Minnesota and is not taken away. So that will be one of our legislative priorities this year. Next question, could you expand more on this section, expand on reporting prenatal exposure to substance use criminalizes women? Can you expand on that a little bit more?
I'm going to call on Rich to answer that one.
Right. I'm not positive I know what the question is, but I think the core issue here is concern that there has been policy discussions about uh, characterizing uh, women who are born with their kids having to be withdrawn from drugs and reporting that to child protection is criminalizing the women. But I think that the focus of child protection is on the child and child safety and well-being. So we think that's the wrong focus. And I think part of what Courtney alluded to is that there have been a couple of studies that are footnoted, I think, on page 35 or 36, one in California and one in Pennsylvania, which indicate that women who give birth and are have exposed their children prenatally to drugs, primarily drugs, not alcohol, are ending up in the system within the first year of the infant's life. 45%, I think, in this Pennsylvania study and 63% in the California study. So, bottom line is there's a lot of other things going on that are getting women who are using drugs during pregnancy that are going to often end them up in the child protection system anyway. So, rather than seeing it as criminalizing women, maybe we should look at it as an opportunity to intervene and provide support to women at that time and both protect the child and maybe strengthen her ability to parent them. So those are some of the factors that have kind of we've really been talking about since this movement began to not report uh, women who give birth to children who have to be withdrawn from drugs.
Right. And I would clarify when we say prenatal, I mean, they're using it at the time of birth. Um, so there was currently that would be a report to child protection where child protection would assess the situation with the mother and for the safety of the child or parents and the safety of the child. There was a task force last year through the Department of Health that recommended that they end reporting and instead do anonymous notification just for gathering of public health data. and that instead of going to child protection, that there be plans of safe care that be managed by a medical provider, which as a medical provider, I would not be able to support that family. And they noted that medical provider managing employment, transportation, et cetera, which is not realistic. And we feel very strongly, given the number of kids dying of drugs, that we should continue to report kids withdrawing at birth and to seriously consider the safety of that child.
I think this also goes to Courtney's comment about family assessment, that this is not a situation where family assessment should be used because, most of us have some familiarity with drug addiction. People don't tend to voluntarily engage in services when they're actively uh, involved in substance use disorder. So if we're going to protect the child and also provide meaningful services to the parent, um, family assessment is not the way to go on that.
Got it. Thank you for that. The next comment, amazing presentation. Appreciate the honesty and believe we all need to be guided more by this data. Do you ever do trainings for CGI groups or judges? Can you send out copies of materials with these statistics? We have not in the past, although we are open to doing presentations. And you can certainly follow up with us with the emails that are listed if you'd like more information or to discuss that. We will be sending out a copy of the presentation at the end of the week to everyone who registered and attended. Another question, domestic violence can be very complex, resulting in the victim parent essentially being penalized and held accountable for being a victim while we protect the child. How can we better support domestic violence victims while simultaneously protecting children? It's a tough question.
It is. And I absolutely agree. Domestic violence is super complex. And the tension there is between protecting the child and making sure not to penalize the victim. Um, what's difficult about the situation is that a lot of the times, we saw in Thomas Towson case, for example, that victims are somewhat reliant, a lot of the times financially, on their abuser, and that makes things really complicated. And I think we need more uh, voluntary supports are not great for that because victims are not in a position to, or abusers don't want to do them, and victims aren't really in a position to force the abuser to do them. So I think we need more structure and more involuntary supports, which is not ideal, but that's kind of what we've been seeing.
I might add, just refer people to part of the report where we talked with a person who ran the domestic violence program in Queens, New York, and essentially just stepped up the management of that area. They set up a situation, for example, where they immediately sent the necessary paperwork to a woman who had filed a DANCO or some other restraining order and gave them the ability to sign it on the phone. And one of the things that did was reduce the number of times where the person came in and withdrew the petition in short order. And then they had law enforcement people who were dedicated and would go to domestic violence who would go out to the home within a day or two. And often they were able to pick up the perpetrator who was already violating the restraining order. So it's some of it is just good management, really. And I noted today that there's been um, shuffling of leadership and the Minneapolis Police Department, which is giving a lot more weight to domestic intimate partner violence or domestic violence. So it'd be interesting to follow that and see how they do it. So if the police and the courts step up their priority for domestic violence, that would be very helpful. I think the other thing to say about this is on two occasions we've gone pretty far down the road for developing a common legislative agenda with domestic violence programs. But at a certain point, it became clear that our priority for protecting children and the priorities they had in terms of allowing women to make the decision about when they get out of a situation and other decisions were in head-to-head conflict, and so we didn't get any further on that. So I think that's it's important for domestic violence and child protection advocates or child welfare advocates to crack that nut, to get together and really figure out how we can work together on making both children and victims of domestic violence safer.
All right, next question. How would you suggest following Safe Passage's recommendations for changes while also navigating the new changes and policies being implemented by DCYF?
Um,
Lisa.
I mean, I
I can
think,
speak to
yeah,
one if you want.
yeah, go ahead,
So
Lisa.
I'll speak to one. In Safe Passage, our mission is child safety is the priority. And so I'll give you one example. So last year, we discovered that the mandated reporter training put out by DCWAF, we did not feel was adequate. They had a mnemonic that said pass on reporting and suggested community support and said not consistent with statutes that said you shouldn't report unless you were certain, whereas it should be reasonable believe, and had almost zero, like seconds out of 45 minutes saying signs of abuse. And we talked with them and they said they didn't think that it was the vehicle for recognizing signs of abuse. And we persisted and brought in Representative Nash and Justice McCaig and said, we really think this needs to be better for people to recognize abuse, and eventually put forth a bill, which passed. And that said that at least 50% of the training needed to be on recognizing signs of abuse, and it needed to be informed by subject matter experts. So we had to put that in statute to have that done, and they have reformed the training. Then that's example of what one thing that Safe Passage is doing, and we will continue to advocate for policies and practices that we think best protect children. It is a challenge, and yeah.
I guess I would also say, we want to hear from people who have concerns or ideas of how the system can be improved, particularly those who are on the front lines um, of child protection. And we are working with several of those people in our coalition right now, and looking at what are some of the policies, what are some of the practices that are in place that are not working, because ultimately, if more kids are dying, something needs to change. And so we really want this to be a collaborative effort where we can all come together and say, what can we do to change some of these policies and practices that we feel like are going to be harmful? We want to be safer for children.
And I'll just clarify Melissa's remarks. So Safe Passage is partnered with the Minnesota Coalition for Child Safety, which is a group of about 40 professionals who all work or have worked frontline on children who have been abused. So that's child protection, guardian ad litem, foster parents, child abuse pediatricians, law enforcement, etc. And so we gather together. We met yesterday, and together we identify where we see concerns. For example, yesterday we were talking about that there's apparently not a straightforward way to report abuse in daycares, in licensed daycares in Minnesota. So we identify concerns and we follow that up. And it's been a very impactful group with a lot of expertise that informs those suggestions.
Okay, next question. How far did you research into fentanyl-laced drugs? Did the caregivers use fentanyl, or did caregiver use um, or did the caregivers use other drugs not intending or knowing it contained fentanyl?
So we go more into this in the report itself, but we had the most common fact pattern, like I said, as a young child ingesting fentanyl accidentally. Um, but there was one case we had was Peyton Jensen, who was he was one of the children at the beginning. He had purchased fentanyl laced cocaine from his mother and his mom's boyfriend and overdosed that way. So other than that, it was a pretty straightforward fentanyl ingestion by a young child.
Okay, next question. Which state or states have the best practices for protecting children and instituting policies to change some of those systemic issues? any model states. Maybe Rich, do you want to comment on that at all?
Right. Well, it's kind of a lifelong quest to answer that question. And I think that the emphasis on kind of the family assessment type programs since the early 2000s has been pretty common across all the states. And I've worked in several states and I've done research and been involved in national associations. So far, this is my experience. I'm not speaking for Safe Passage or any other researchers. Um, I have not found states that are exemplary with the possible exception of Utah. Utah, for example, has um, a data collection process where they feed information about cases directly back to workers and supervisors. Everyone, including supervisors on up to the secretary of the state agency, does case reviews using, a really strong protocol for looking for safety issues and just quality issues generally. So they have a much more kind of robust management structure than I've seen in other states. Um, I think the two-track thing where they have family assessment or alternative response is really uh, water down child safety nationally. I think it would be interesting. I'd recommend that you look at the livescutshort.org website, and you'll see a lot of the same kind of stories coming out of other states. So that's my personal experience. I just haven't, and I'm a life, career long. I've done a lot of work on searching for best practices in this area, others as well, and so. I'm sorry to say it may not be, there may be others who have better information, but that's been my experience.
Yeah, I will say, I think we can draw from other states, even like Washington State. We met with someone from there yesterday who um, showed us that, every time a child dies, Washington State will issue a child fatality report, is multiple pages long, with redacted information, but much more comprehensive than what we're putting out from the state of Minnesota. So I do think, and that's part of what we're doing at Safe Passage, is looking at what other states are doing and drawing on some of the
Yeah. Well,
best
that's a
practices.
good point, Melissa, because I think there are individual good practices that you can look at from other states. And so and the other is around transparency. Generally speaking, there's not great work on that, but some states do have good practices. So if you go to various states and look for what they are doing well, you could assemble, a pretty good set of practices. There just isn't anyone that I know of. And again, I don't have a comprehensive knowledge, but I have a pretty good look. Uh, Anybody that I know of that has a really good system other than potentially Utah.
We've got several more questions, and I'm looking at the time, so I'm going to try to work through these a little bit quickly. I'm just going to comment on there was a comment about the Guardian Ad Litem program not having a plan to end the volunteer program. So there's a paid and then a volunteer program. Obviously, Safe Passage is supportive of both, but knowing that there is a severe shortage of Guardians Ad Litem here in Minnesota and that the volunteer program did nearly close recently, we are supportive of making sure that that's codified in statute, that the volunteer program would not go away. But we are wholly supportive of both the paid and the volunteer Guardian Ad Litem program. Um, Someone had asked also if the data is available by county, the fatalities, and yes, it is on in the report. You can look for that.
But wait,
Um,
Melissa, we need to clarify that, Courtney, you can, that it's the fatalities that we knew. It's not that the counties tell us how many fatalities they had. So there could be fatalities that are not reported in the counties. Those are only the ones that we found through media reports or nonprofits. So
yeah.
that is not the definitive number of fatalities per county. You can correct me, Courtney, or clarify.
Correct. So we had 44 children in our report. There's always the possibility of more children being out there that we weren't able to find and identify. But the fatalities by county are information we have for those 44 children.
But I
Yeah,
would
states and
say,
counties do not automatically release information about fatalities
but I think
in our
it's worth
state.
worth pointing out that this report, I think we have confidence that we have identified the vast majority of child fatalities because we significantly expanded the source of information. There are several new sources of information that Melissa and Courtney and others have found. So we have a much more comprehensive look at how many children were killed. So there may be a few out there or some out there, but I think we've gotten most of them.
Yeah.
Yeah.
Is there a way to determine fentanyl exposure due to drug abuse versus fentanyl given as pain relief during labor for newborn screenings?
Um, yes, usually parents who are given or pregnant women who are given fentanyl during childbirth do not have CPS interactions after that. Lisa, maybe you can speak more to this, but uh,
Well, it
we did
would,
not have that in this report. And if a woman was given fentanyl during pregnancy for pain relief, we would not count that.
right. And that would be noted in a medical record. And the child would not be tested unless there were certain parameters met. And obviously, our main concern is kids who are withdrawing from um, narcotics at birth, which would be more long-term use.
Okay, next question, maybe a little bit vague, but what are your thoughts on timelines? I know culturally some don't believe in timelines, so maybe timelines for removing children, bringing them back into the home. Um,
I imagine they're talking about statutory timelines,
mhm.
which I am not. It was kind of outside the scope of this report. I'll let Rich answer this one as if he has a thought about this,
Yeah,
but
I know Dina's not on today. Is that correct? Because she
No,
would,
she's
no,
not.
and she would
yeah.
unfortunately be our expert on timelines.
Yeah, you know what? I don't know. That's not an area that I'm deep in, but what I do know, I'll share. And that there, one of the concerns is that there's a variety, that there's variation across the state and how much attention courts pay to the federal timelines for removal. My personal view is it's about good casework and about whether good progress is being made on addressing the issues that keep to keep children safe. Um, but if you take a case and you just string it out for years on end, and then at the last minute you remove a child from foster care and send them, to back home or to some kin, that's not good for kids either. So I think it really comes down to good casework decisions. That said, you kind of have to pay attention to the federal guidelines because they're in the law, and you do sometimes get audited on that. So that's not, a very comprehensive answer, but it's just sharing what I know.
All right. Next question. You referenced that the system is more about protecting parents than children. Wondering if you have specific recommendations to DCYF and legislators about ways to change processes and procedures, screening guidelines, and financial resources to counties so they are better able to respond. Many counties are currently vastly under-resourced to be able to provide active efforts as MAFPA CWDA requires. Lisa, do you want to maybe talk about
Sure,
our
I'll note. I mean, we have lots of ideas, and not enough time um, and personnel to do all of them. I mean, our Safe Passage and the Coalition are limited to 3 bills a year, but we from the coalition we have a list of ideas that would be helpful, and we will continue to advocate for that. I want to acknowledge the under-resourced issue, and one bill that we're going to put forth again this year, which we put forth last year and didn't pass at the last moment, is fiscal analysis, which is essentially where is the money coming from? Where can Minnesota get the money and where is it going to? There was a consultant 2 years ago who testified, and I think the number was that Minnesota left something like 140 million on the table of TANF funds. And so the concern is, are there funds that we're not accessing? And then where is the money going to? And obviously, with today's situation of fraud accountability, this is ripe for passing, we hope. Because we are really concerned also. There aren't enough services for the chemical dependency issues, for treatment, of mother or parents and child together, mental health support, trauma support. We agree with you, and that's why we're fighting for this. So please join us, sign up for our email, briefs, come with us to the day at the Capitol, and we'd love to have you with us.
Can I just add to that, just to parse out the difference between adequate caseworkers and adequate staff to address active efforts? There were 600 staff added statewide in 2015 as a result of the governor's task force from that era. And the state had been asked to do an annual survey of staffing. They have not done that. But what information we've got back at that point in time and dribbles here and there since make me wonder whether we might have adequate staff around the state, although, it depends on each unit in each county, but overall, but it, and we may have enough staff to do the job. There were some pretty eye-opening numbers that came out during the task force of people having, just a handful of investigations per month and things of that nature. So I think we need to have the state really go out and do a solid survey to see what the staffing situation is. But it is much clearer that we don't have enough services available for caseworkers to actually implement what we're being asked to implement even before active efforts. And each of I think it's three federal child and family service reviews that have been done in Minnesota have criticized the state for not having an adequate array of services to actually implement the case plan. So those are just I just wanted to parse out those two pieces.
Great. Thanks, Rich. Last question. Can you talk more about reports of prenatal exposure when the substance is marijuana? Safety planning after birth gets a little tricky now that THC is legal. We always have safety plans around safe storage and ensuring the child has access to a sober adult, but should there be more? Lisa, do you want to tackle that one?
I don't have depth of knowledge about what the current practice is with marijuana. We've been focusing on deaths due to opioids, which I think is the main concern. Certainly with marijuana, I agree the safe storage, sober adult is important, but honestly, our focus has been on opioids, which are killing 20% of our kids a year. And I think our state really needs to focus on opioid use and the safety of children.
And I'll say just inside the scope of the report, cannabis and THC did not come up that often. I only really saw THC come up if the mother was, or when the child was born, the mother tested positive for THC. Other than that, there were no fatalities due to THC, so it is a little bit outside the scope of the fatality report.
All right. Thank you, everyone, for joining. We appreciate it. Thank you, Courtney. Thank you to our board members and the authors of the report. Once again, we encourage anyone who is interested in talking with us or having us present or joining us at the day at the Capitol to get in touch with us. We would love to partner and ultimately hope these discussions inform efforts to better protect children in 2026 and moving forward. So thanks, everyone. Have a great day.
Bye, everyone.